Patients who are morbidly obese die much younger. For example, a 40-year-old female with a BMI of 40 will die up to 10 years earlier. The reason for this is that diabetes, hypertension, cardiac abnormalities and sleep disorders, including sleep apnea, are all much more common and made worse by obesity. When morbidly obese patients with medical conditions undergo surgery and lose weight, there's a rapid and marked improvement in their conditions and their long-term outlook. Maturity onset diabetes is cured in over 3/4 of patients undergoing gastric bypass. In Ireland, surgical intervention is covered by all the medical insurance companies, which has resulted in more and more Irish people being interested in the surgical option. All patients attending the surgical service have the benefit of my 15 years experience in this field, during which I've treated over 1,000 patients. I work with a large and very experienced multidisciplinary team of dietitians, physiotherapists, psychologists and medical consultants experienced in cardiology, endocrinology, gastroenterology and respiratory medicine. We have recently written a book entitled Weight Loss Surgery, a Comprehensive Medical Team Approach. This book is aimed at general practitioners and patients and is a comprehensive guide to bariatric surgical intervention. We adhere to international guidelines when recommending surgery to patients, and by international criteria, all patients who are morbidly obese, i.e. who have a BMI of 40 kilograms per metre squared or higher, and who have tried all conservative means of weight loss and failed to lose and keep off meaningful weight, should be considered for surgery. Furthermore, any patient with a body mass index of 35 kilograms per metre squared or greater who has reversible obesity-related medical conditions such as diabetes, hypertension, sleep apnea, as mentioned above, should be offered the option of surgical referral. Laparoscopic gastric bypass surgery is considered the gold standard bariatric procedure and promotes weight loss by restricting the amount of food that can be ingested. The patient feels full more quickly and therefore eats less. The length of intestine through which the food passes is reduced by creating a roux limb. Surgery usually involves making 5 1-centimetre incisions. A 30cc or golf ball sized stomach pouch is created by utilising endoscopic stapling devices. The small intestine is then divided and a 100 centimetre roux limb is brought up to join the new stomach pouch. Downstream from this, new gastrojejunal anastomosis, a jejunojejunal anastomosis, is formed to restore bowel continuity. The operation takes approximately 1 hour to perform. We are also a member of the International Federation for the Surgical Treatment of Obesity Clinical Excellence Programme and are the only Irish centre, and our outcome data is periodically externally reviewed. Surgery usually involves making 4 1-centimetre incisions. Over 2/3 of the stomach is removed and the remainder is converted into a narrow tube approximately the shape of a banana. It is a particularly good procedure for people who have a tendency to eat large portions of food. It is easier to perform in super obese patients, that's with a BMI of greater than 50 kilograms per metre squared. It has a low complication rate. It is easy to convert to another weight loss procedure if weight loss is inadequate. Laparoscopic sleeve gastrectomy is a purely restrictive procedure. Very good long-term results. In summary then, there are a number of effective laparoscopic bariatric procedures available. Selection of the most appropriate operation should be determined by a surgeon experience and patient characteristics. Bariatric surgeons should be able to discuss the full range of therapeutic options with their patients. In general, the more complex the bariatric procedure, the greater the weight loss. When choosing where to have their surgery, patients should be advised not to go anywhere where they have to fly, speak a different language, or change currency. We've written a book entitled Weight Loss Surgery, a Comprehensive Medical Team Approach. This is available through Curragh Press. We also have a website, www.obesitysurgery.ie. You can also access the Bon Secours website, www.bonsecure.ie.